The U.S. Department of Health and Human Services reports that almost 365,000 people had signed up for the health insurance through state and federal marketplaces by the end of November. The rate of participation has increased as serious glitches in the federalhealthcare.gov website have been worked out. While more people are able to access health insurance, access to health services is an issue, especially in rural areas. Clifton Adcock reported on the plight of small hospitals for Oklahoma Watch, and I talked to him about his findings. Clifton, a lot of Oklahoma hospitals are in trouble. Why?
Well, the first thing is declining patient revenue, or declining patient numbers, actually. When the economic downturn hit, you saw a lot of people foregoing medical care. It's really bad in the rural areas. You especially see these financial declines for these small rural hospitals, largely because they don't have patients coming in.
Specialty hospitals seem to be doing fine.
Correct.
It's the non-specialty hospitals, the general hospitals, that are having the biggest problems.
That's right. And one of the issues is that doctors move their practice outside of the hospitals, so patients don't come into the hospitals to get care and lab work.
Along with the decline in the number of patients, there's also been a decline in Medicaid reimbursement as well.
Correct. There's been a decline in Medicaid reimbursement. Most of this is not a product of the ACA, but it's a product of the sequestration that caused a 2% across-the-board cut for all hospitals.
So it's a financial problem that is affecting communities, and when a hospital is affected, it has a ripple effect in a small community.
Correct. Hospitals are one of the largest employers in small communities. And so when you see the hospital having to cut services or lay people off, it has a big economic impact on those communities.
Why are small communities having a difficult time attracting doctors?
There's a variety of reasons. First is that doctors many times want to set up their own practices. Also, working in a small hospital, a doctor has to be a jack of all trades. They have to work the emergency room, the clinic, as well as whatever specialty issues may come up. But in large cities, they are able to focus only on emergency room care or a clinic care. And so they're more attracted to those larger areas in hospitals.
One of the quotes in your story said that a lot of hospitals, especially in rural areas, have become Band-Aid stations.
Correct. They've had to cut services to the point, in many cases, that they're simply emergency rooms, and having doctors there who perform specialty care or, for instance, OBGYNs, there's a large shortage of those here in the state, which leads to more doctors locating in urban areas.
Ironically, even with the financial problems, the outcomes are often very good in smaller hospitals.
Correct. They still have to maintain a certain level of care. And the nurses, the doctors, and the staff there still, they're on a more personal level with the patients. And they're able to provide good care still in many cases.
What is the effect of the Affordable Care Act on hospitals in Oklahoma?
Well, that's uncertain yet. They're still trying to sort out exactly what's going to happen. It's just now taking effect, and so there's a lot of uncertainty about what's actually going to happen with the Affordable Care Act. While there's not a silver bullet that would solve all these small hospitals' problems, they say expanding the state's Medicaid program would help alleviate some of the pressure.
And Oklahoma elected not to expand Medicaid.
Correct. Governor Fallin decided not to expand Medicaid, and this is, a lot of hospital groups see this as a bad issue for them, in which they're not getting reimbursed.
In some states, small or community hospitals have actually gone bankrupt, have gone out of business. We haven't seen much of that here in Oklahoma, but there is at least one hospital that has been declared bankrupt.
Correct. That's Pauls Valley Hospital. They had quite a lot of financial issues, but a lot of the experts are worried that if this trend continues with small hospitals losing money, that you will see more bankruptcies and possibly closures, or at least mergers with larger operating companies.
So in your reporting, in your discussions and interviews with people that are close to this situation, what do they see as the solution?
Well, as I said, there's no one solution that will help pull these small hospitals up. A lot of folks said that expansion of the state's Medicaid program would help. You have a lot of people in these rural areas who aren't insured or are not covered by Medicaid right now. And so expanding that would allow them to at least get reimbursed something, even if it's at a lower level than insurance or Medicare.
Clifton Adcock from Oklahoma Watch, thanks for joining us.
Thank you for having me.